middle school and high school.
Yes, sir.
Okay, thank you.
Mr. Chairman.
Sir Whitmire.
Not to be critical, because I assume you live in the real world and a wealth of information, but when you say to Center West they can go to Parkland for primary care, mental health, have you tried?
I've been in those clinics and I
I
have
mean,
seen it.
how do you access them? Harris County, for instance, where I'm more familiar, you get a 3-month appointment 3 months from now. So if you got a 14, 16-year-old who's out of control, terrorizing the family and probably the school, although he or she may have been sent to an alternative school, and you try to access without insurance mental health care in Harris County, you'll get a 3-month from now appointment.
Absolutely.
Which, when we sit here and throw concepts or plans, I think we have to be very sober with our dealings. I routinely, chairing criminal justice, will get calls from a single mom with a 14, 16-year-old son. What can you do? Unfortunately, I talk to the authorities, probation and hospital district, and essentially I have to explain to them they haven't committed a crime yet, and I can't get them any treatment. So that's, I want to put that face on it. And then number two, I want you to know, when we talk about counselors, I have schools in HISD that have no counselors and no nurse. And I don't know who we would expect to deal with these 900, 20,000, or the other just emotionally disturbed children on a daily basis. So that's the kind of the setting, the tone of our meeting today. We're really trying to play catch up, and Senator Huffman's absolutely correct. Our main focus for this committee is school safety. Of course, we know all of it's related to school safety because they don't, you know, I'm describing some family circumstances, but they take that to school. And unfortunately, I will close with my observation. We have about 145,000 people incarcerated today at 106 prisons.
Yes.
We did a study a couple years ago and found 32,000 that year, 3 years ago, that were in a mental health program before they ever committed a crime. But because they couldn't get counseling, the medication, they have an episode, they assault the family or the neighbor, law enforcement's called, they assault the officer, and welcome to the criminal justice system. So I guess one of my messages would be, if you agree with, either pay now or you'll pay later. And unfortunately, you may pay later with your life. So it's a very complex issue, but when you say they can access Parkland, yeah, if they've got a lot of patience, but if they're in a crisis and they've waited, as you mentioned several times, the problem is the delay in responding to some of these symptoms or conditions can be fatal.
I do agree, Senator. I think that's very well stated. And, you know, last year we had the opportunity funding through the Houston Endowment to do a very in-depth study of Harris County's mental health systems. And, you know, I haven't been focusing on the dramatic gaps, but there are dramatic gaps. And that report documents them at every level. And you're absolutely right that children do not have access to what they need, and we will pay later if we don't do things now. I guess the reason I try to emphasize the things we have is I do think there's things to build on. You're going to hear later from folks at Legacy Community Health. This is a fantastic provider serving impoverished communities, school-based clinics in your community. And those models can be built on, and it's not a panacea. It's going to take a long time. But by doing that, we can intervene earlier, and then by doing things like the multi-systemic therapy program, which is also in Harris County, and doing more of that, that's exactly what the person you just described needs. They need somebody who can get them, first of all, they need to get that stabilized. Maybe they go to a hospital, which is also hard to get to. We documented that. We documented, by the way, Senator, it's not that you don't have enough hospital beds there, it's that most of your hospitals aren't going to serve that child because they're going to require insurance, or they're going to say it's too complex, or they got drug abuse and we can't do that. So there's hospitals there, but most of them aren't going to help that child.
But it's such a cost factor. When you
Yeah,
say hospitals,
yes,
you're talking about the private sector.
No, sir.
We got hundreds of thousands of millions of Texans without the health insurance, and to access the public hospitals, there's a huge waiting list.
Exactly.
And one last thing, Senator Huffman created the diversion program in our jail for mental health. We're getting a little off school safety, but it is related because it also is the situation with our youth. The problem is you stabilize these folks, and then the transition, the reentry. We stabilized people in Harris County Jail like never before, but on Friday when they're released, they have absolutely nowhere to go, and they fall back into their same dilemma. And the same thing with the youth as well.
You're absolutely right, sir. And I do not want to imply at all that these are going to be easy things, but I think we're trying to just say, incrementally, how do we get a little bit closer?
Sure, I understand.
And the last thing I guess I'd like to say, Chair Taylor, before I finish, I appreciate all the questions, and sorry this has taken so long, but is that you have a program in most communities now in the state that could be used to treat psychosis. We have one that the Harris Center and the Harris County Psychiatric Center co-do in Harris County. We have them now in the Panhandle, we have them in the Valley. And these are these coordinated specialty care teams that are designed to treat psychosis within the first year of symptoms and to stabilize it before things get worse. The problem, the thing we need, that we would like you to address on that is right now, no one under the age of 18 is getting care through that. We need to really make a concerted effort to get these programs to those youth, the 15 to 18 age youth who are in our schools, who right now aren't being able to take advantage of these. And we can build on the programs that are there, and we're probably going to need partners with our medical schools too. But we think that, again, there are incremental steps that you all can weigh as you think about kind of how to help this be less likely for these tragedies to happen in the future. Thank you.
Sarah Huffman has a question.
Yeah, just briefly, and I'm going to tag team Senator Whitmire today, it looks like. But I again agree with him, and I like that you're focusing on the positive, so I appreciate that, what we can build on, because that's what we need to know. But this is really hitting home here where I'm looking at this, where it's saying, even with the onset of psychosis, that treatment is delayed for 7 years. Is that right? I mean, we have to know why it's delayed if you want us to fix it. So, what is it? The things you just said about that they won't treat under 18-year-olds, is that part of it?
That's one barrier.
That's one. Is that a major barrier?
It's a major barrier.
Okay,
The other barrier is.
What's the other ones? Because we need to know.
The other barrier is capacity. You have the capacity to serve maybe 400 people right now.
So are there waiting lists?
There are some waiting lists, but the waiting lists actually are not that long for that.
Okay.
Because the issue is, when someone has a psychosis, we gotta find them. And
Okay.
parents are, and I did this as a parent, we're
Okay.
very good at not seeing illness in our children. We're very good at saying, hey, Andy just likes standing
So-
out in his room.
So this isn't all to blame on
Oh, no.
facilities and capacities and things that maybe the state or counties or locals have provided or not provided. Part of it has to do, again, with parental responsibility. Is that correct? So kind of going back, or
Sure.
just parental acceptance, community's acceptance.
Parental knowledge that something
Yeah.
that can be done. I mean, I think
Right.
parents, if you talk to parents who have children's psychosis, it's very isolating. They can't talk about it with their friends. None of their friends are saying, hey, we got help. I mean, and I think that changed. Like, think about how it used to be with cancer. With cancer, we didn't talk about it.
So it's the stigma, like
Stigma
Dr. Schwartner was talking
And
about.
hope of treatment.
Yeah.
Like, no one's gonna ever want to go get treatment if they don't think it's out there. I mean, people are rational actors. So I think you've touched on it, Senator, and I think those are exactly the incremental opportunities to make this somewhat better.
So again, a complex issue that's not just one answer, and it kind of weaves into all of these issues. It's what the state can do, but it's what parents can do, it's what the schools can do, it's what the community and churches can do. It's all really correct.
Exactly.
All right, thank you.
And when you say primary care physician, I'm thinking about my primary care doctor. That's what you're referring to, right?
Yeah.
So and these are more, these mental health issues, the 20,000 and the 900, these are more severe, right?
Correct.
Does a primary care physician really have the capacity or the medical training to handle that, or?
They have the capacity and the medical training to find it,
To
just
find
like they
it.
do with cancer.
Okay,
So
that-
they couldn't treat my mom's breast cancer. They didn't have the training, but they found it.
Okay, so what you're saying is these kids see their primary care physician, but they're not being referred by the primary care.
Then the primary care doctor's not finding. They don't have time. They don't have the tools. They don't see themselves as. Also, they don't know where to go. I mean, we're digging ourselves out of a deep hole here where people have kind of gotten used to. We just don't have the treatment. Now that we have the treatment, we need to start systematically getting people to have access to it and incrementally building it up. if that
Okay, I'm
makes sense.
sorry, I'm on your page 7.
Yes, sir.
Slide 7. That top sentence, tell me exactly what you're saying there.
So, right now, if you are going to get treatment, you're going to get found in primary care. And
And it says they're treating them.
and they're treating mental illness. They're not treating all mental illnesses. They're treating mental illness. Usually it's ADHD, anxiety, depression. We can build on that base so that they can find more, and they can keep treating the low-level ones that they're perfectly able to treat, but they need to then have the referral linkages. And these CPAP programs give them access to someone to help them make that decision, what they can treat and what they can't, kind of empower them to ask more questions so they don't get into situations they don't know how to get out of, and then can help them get to the right care program.
So what you're saying is the 75% that they can treat is like ADHD and this, and then the other 25% get into our 20,000 and our 900 that need to be referred.
Yes, sir.
Okay, thank you. Any other questions, members? Thank you.
Thank you, sir.
It's always good being the first